Dr. Nisha.
Good evening, everyone. So I'll be presenting the topic as visual, sensory, and motor deficits in children with most prevalent developmental disabilities. So top 5 developmental disabilities are Down syndrome, ADHD, cerebral palsy, and ASD, and fetal alcohol syndrome. So children with these disabilities have numerous ophthalmological deficits affecting the anatomy of eye as well as the sensory and motor aspects of vision. There has been discussion in literature regarding the association of ocular manifestations and severity of the disabilities in each of these conditions. So in ASD, there is a study found that 40% of children with autism had identifiable ophthalmic issues, most common being refractive errors, strabismus, and amblyopia. Many symptoms that characterize the autism, such as odd body posturing, gaze aversion, preference for peripheral vision, and visual stimming, have been suggested to be due to faulty vision. And there's high prevalence of strabismus, around 20%. And in cerebral palsy, children with cerebral palsy have high prevalence of 50 to 90% of visual impairment. Common ocular findings are refractive error, esotropia, exotropia, isolated vertical deviation, and nystagmus, and some abnormal dysmorphology also. Accommodation responses are affected in children with CP, with some of reports suggesting a relationship of accommodation with intellectual impairment and communication ability. In ADHD, which is the most common neurodevelopmental, one of the most common neurodevelopmental disorder in childhood, worldwide prevalence of 2.2 to 17.8%. So they have reported have a higher association of convergence insufficiency, reduced stereo acuity, refractive error, and accommodation abnormalities. In Down syndrome, it is one of the most common chromosomal conditions in the world, and ophthalmic findings reported in DS include refractive error, amblyopia, strabismus, the NLD obstruction, nystagmus, keratoconus, cataract, retinal abnormalities, and optic nerve abnormalities. The most common refractive error in children and adolescents with DS are hyperopia and astigmatism. The association of esotropia and nystagmus in DS is also high, and accommodative lag with reduced amplitudes of accommodation have also been reported. The aim of the study was to study the visual, sensory, and motor deficit in these most four developmental disabilities, and the objective was to compare these four disabilities and see if there are any difference in prevalence of ophthalmic disorders and any differences amongst them. We have included all the children between the age of 6 months to 16 years with these four disabilities, and in whom the ophthalmic and orthoptic evaluation and refraction could be done conclusively. We have excluded the children with other neurological disorders with any history of intraocular surgery, or in whom an optimal ophthalmic evaluation could not be done. Study area was the Eye Care Eye Hospital and PG Institute, Noida. Population was all the children with, diagnosed with these four disabilities, and it was the hospital-based non-randomized prospective study. So we have included 48 patients between the age group of 6 months to 16 years diagnosed with these four disabilities, and participants underwent age-appropriate complete ophthalmological examination and orthoptic assessment. So the most prevalent disorder observed among them was the autism spectrum disorder, followed by ADHD, Down syndrome, and cerebral palsy. Refractive errors were seen in 37.5% of the cases, with ASD showing the highest percentage, but there was no significant difference was found in prevalence of refractive error and the specific disorders. Myopia was the most common refractive error across all. Strabismus affected 39.6% of individuals, more frequently associated with Down syndrome and cerebral palsy, and esotropia was the most common strabismus type found across all the disorders. And in cerebral palsy cases, esotropia was the only type of strabismus found in our study. Amblyopia was present in 16.7% of total cases, showing significant association with ASD and Down syndrome. Most common type seen was refractive amblyopia amongst all. And some other ocular findings were also found, like CNLDO, nystagmus, conjunctivitis, congenital ptosis, dry eyes, and allergic lid edema. And reduced neuropsis is most common sensory deficit found amongst all. So conclusion is that in our study, autism spectrum disorder was the most common developmental disorder. Refractive errors were seen in 37.5%, which was highest in ASD. Esotropia was the most common type of strabismus across all developmental disorders and the only type in cerebral palsy. So all cases with developmental disorders need detailed orthoptic evaluation and early ophthalmological examinations. Thank you.
I have two questions. Sometimes this ADHD and ASD has mixed spectrum, so we cannot clearly demarcate between ADHD and
Yes,
autism.
so we have.
In such cases, how do you do
So we have taken few cases, around 6 or 7, which have both ADHD and autism spectrum, diagnosed by the pediatrician.
when they have mixed features, how do you segregate between ADHD? How did you allot the patients under ADHD?
So we have taken separately both the cases in both the groups. Like one patient with ADHD and autism, we have taken them separately under ADHD and also under the ASD.
Counted them as two patients.
Yes.
Okay. And what if you, when you detect amblyopia in such cases, did you use the same visual acuity estimation test for all the patients?
No, so we
because
have
many might have different level of delayed milestones.
Yeah,
so
yes,
one
so we
test might be giving a not a correct value when you.
Yes, so we have taken the visual acuity according to the age spectrum and as much as
what I'm trying to tell is some test might overestimate the vision. So in that
Yes.
case, you might not be able to clear
Yes, sir.
tell that amblyopia is present
Yes,
or
sir.
not.
Also, in all the patients, were you able to do all the tests? Like, there would be a couple of multiple patients, in fact, where you
Yes,
would
ma'am.
not be able to do a stereopsis, maybe. And
Yes,
some
ma'am.
other evaluations.
Multiple tests were not.
Yeah.
We were not able to perform, like especially in cerebral palsy patients.
What was the youngest patient?
Ma'am,
Yes.
8 months.